Hi everyone. This week I downloaded the app Calm and the app K Health. Um, and the first one I looked at was Calm, and I really like this app because it was designed more for mental health. And how it was designed and organized is it was a lot of soothing talks in specific categories, and this was to help the user with sleep, stress, anxiety, self care, inner peace. Those were a few examples of the categories. But unfortunately, a lot of the app was actually locked. And you could access it only if you paid the $70 a year to subscribe. So I wasn't able to look at a lot of the app, which is one of like the cons and the downside of the app. But what I was able to access was one of the like talks on anxiety and reducing anxiety. And I actually found it really relaxing. And how they talked, it sounded a lot kind of like a one-way like therapy in a way, because you can't really like talk back. But it seemed like it was trying to give you like healthy coping mechanisms and like what anxiety is. And so I certainly saw how it could be a very useful app, especially for mental health. It seemed definitely like a healthy coping mechanism to use if you have anxiety or if you have stress. Unfortunately, it is kind of like pricey, um, but compared to like actual therapy, sessions, that could be a good outlet if you can't afford to go to therapy regularly. And it seemed like there's a lot of content too. Like there's probably like 20 talks on each category. So it was pretty expansive. And then the other app that I looked at was with K Health, and this was more of like a symptom checker, and so it was in the form it was formatted kind of like a online chat. So it would ask you like what's your symptoms, and then it would compare you with everyone who is the same age and sex of you with those same symptoms. So as it asked you questions and as it asked you symptoms, it compared you with the people who also had those symptoms, and then kind of gave you a diagnosis sort of. They made it very clear as you go through the app though that they aren't doctors and they aren't medical professionals, that this is more of just like a comparison. It was kind of like an Expedia but like for like health symptoms, which I thought was really helpful, because when you Google your symptoms, it can be very vast and it can be kind of scary too, especially if you click on like WebMD, um, because there's kind of like a bias in a way, and you can give yourself symptoms that you think you have, whereas this it asked you what symptoms you have. So I really liked that, and it kind of reminded me back to like related it back to the textbook, how they talked about a lot how health information is often spread peer to peer because people don't really have quick access to medical care. And historically, like it was within tribes how they would kind of spread it in like communities, just smaller communities would spread health information. And this is nice because it's just one very big community. So you're able to get a lot more information with that. So it's a very good tool. And I definitely don't think it should be like relied on as like an actual to use like as a diagnosis, but I do think that it's very thorough, and it's a good way to start if you do have like some symptoms that you have. It's a lot more specific and clear. But yeah, those were the two apps I reviewed, and I thought that they actually were like a good step forward in utilizing health within technology rather than a step back for sure. So thank you.